So I'm going to talk to you about lateral epicondylitis, or tennis elbow as it's commonly referred to. Lateral epicondylitis is a typical degeneration of the extensor carpi radialis brevis from overuse, typically from athletes playing tennis or something like that. The extensor digitorum communis and the extensor carpi radialis longus can also be affected. In lateral epicondylitis, there's inflammation and small tears of the tendons near the lateral epicondyle. But Chelsea's going to talk to us now about the progression of treatment for lateral epicondylitis.
So, treatment for lateral epicondylitis in the beginning phases is going to include ice, friction massage, kinesio tape, as you can see on Jimmy's arm here.
Whoa.
Radiohumeral mobilization and ultrasound for 6 to 10 minutes if you choose to do so. It will also include rest, and you will administer a home program that will be changed throughout the rest of their progression. After the inflammation goes down, then you can finally administer the dry needling, as you will see in a video later on, and you will be giving them some light stretches. After 4 to 6 weeks, then you can increase the intensity of the stretches, and if their pain still doesn't subside after 8 to 12 months, then you can consider having surgery.
So we're going to show you guys some special tests for lateral epicondylitis. First one is Mills test. We're going to have her straight here by her side, and we're going to stretch the extensors here. She should have pain right here, indicating lateral epicondylitis. And the next one is Mosley's test. She's going to be right here. Spread her fingers. Her third digit, she's going to resist. And in doing that, she should feel pain here, also indicating lateral epicondylitis. And then we're going to move on to the Cozen's test. And she can either be sitting or standing, And as she makes this fist, she is going to gradually go up, and in going through extension, she should have pain through here as well, indicating lateral epicondylitis. And lastly, we have her do the grip test at 90. So she's going to squeeze it as hard as she can. She's pretty strong, just let me know. And then she's going to extend, do the same thing. Not as strong. That indicates lateral epicondylitis. Okay.
The area with alcohol here.
So we have dry needling technique here.
And then they really stress the importance of when you're cleaning the area that you always want to wipe in one direction. You don't want to go back and forth because then you're going to contaminate it. And then we also clean our gloves. Oops, sorry. Got a little on your pants. All right, and then this is the needle that I'm using. There's different sizes and different thicknesses, but this is the one that we're using. And the needle is inside of a plastic tube. It's actually glued inside of that, and you have to kind of click it to break it loose from the tube itself. So it's loose and ready to go here. So I've been working with Victoria for a long time, so I kind of know where her spots are, but if she was a new patient, I would be palpating in here and trying to find an actual trigger point area, but I know where I'm going with her. So in this technique here, I'm just going to go ahead and grab the muscle. So I'm going to pinch it, and then the needle's going to go straight down through this way. So we go down in. And on this one, I'm not tapping bone or anything, so just go into the depth I want to go. And then we're going to piston it, so that means I'm going to move it up and down. And I'm kind of redirecting the needle as I go so that I'm getting different areas. And she's...
Does that hurt?
And not much. Some spots really hurt worse, but it's not kind of achy. Do you want her to stick one in you?
No.
So that's one way, and then I can also just go straight down on it this way without grabbing the muscle. Let's see, I don't know if we can get an area that'll actually, well, that was her twitching. But let's see. we can get an area where the actual muscle will twitch. I don't know if we're going to be able to see anything.
So what is this doing?
So we're trying to just get the muscle to relax. The electrical impulse basically of the muscle can disrupt it, disperse it, make it relax. Other side of it.
Can we explain her condition and how she's feeling from it now?
Sure.
Oh, it's helped, yeah, a lot. The soreness and when I, certain motions, this motion, they don't bother me.
Okay.
So,
Awesome. Do you feel like this is the best treatment that you've received as far as pain relief and things? This has helped the most.
yeah, yeah.
There was a cortisone shot before,
Yeah, cortisone shot.
which helped for 8 months.
It worked for 8 months.
And then you did this, which is working just as well.
And I would prefer to do this
Oh, good.
Okay.
as far as the cortisone and, you know.
Right.
And my doctor
Awesome.
didn't want to do that anymore.
And we have done exercises and stuff with her too, but the exercises actually caused her to have more problems with her wrist. It was really bothering her wrist, and she wasn't really getting much benefit out of it as far as the elbow goes, so we actually just discontinued the exercises, and this is all we're doing
Okay.
for her elbow.
So usually, is that what you would do?
No.
So usually you would do this
Usually
and
this
exercise.
is just part of it. Yeah, usually I would still be doing massage. We would still be using the tools to get in there and do the massage that way. We'd still be doing the exercises, especially the eccentric exercises,
Okay.
ultrasound, occasionally IATO. But with her, this is just what works, so this is what
Okay.
we've been doing.
Perfect. All right. Thank you.
You're welcome.
Hi, so we're here with Ms. Hazlett. I say it wrong every time. But we're fortunate enough to have him explain dry needling to us. And could you, sir, just explain the rationale behind dry needling, why it is such an important treatment?
Okay. Most people have heard of trigger point injections, and they're familiar with that, and that's something that works to help tone down a muscle. So if you have a knot that's in a muscle that is a hyper irritable spot and may refer pain elsewhere, we call that a trigger point. And trigger point injections have been used for a long, long time, but they found that whether or not you use medicine, it still works if you have an appropriate placement of the needle. And so they call that the needle effect, that getting a needle in the trigger point to discharge the trigger point works whether or not you use medication with it. And so we call it dry needling because we're not using medication.
Okay.
Makes sense.
Awesome. How about some other forms of treatment you would use along with dry needling?
And this is specific for lateral epicondylitis?
Please.
Sir, subacute phase.
All right, so we still wouldn't leave out the more traditional forms of therapy. One of the very common forms would be Aston or Graston, where you're using the tool-assisted soft tissue mobilization. And if you're in the subacute phase, you can still use those tools as a form of soft tissue mobilization, but you're not going to be as aggressive as if it were chronic. So when you're in a chronic phase, you're not in an itis anymore, you're in an osis. You got a condition that's not healing. You no longer have an inflammatory phase. So the purpose of the scraping then is actually to restart the healing cascade. You're going to be aggressive with it. You may cause some bruising as you're scraping. Your patient with the subacute phase, if we were to use, you ask what other modalities or treatments you'd use. You could use the scraping, but you'd be more gentle with it.
Right.
Okay, now that's going to help get blood flow to the area, bring in nutrients and so forth. You'd still work with your exercises. They're finding, though, that you want to do more eccentric strengthening with your medial and lateral epicondylitis patients.
Okay.
We wouldn't leave out ultrasound. We'd probably use that. If it's still an inflammatory phase, you might add hydrocortisone, so it's phonophoresis. You might use iontophoresis. We use kinesiotaping. We also do joint mobilizations, so radiohumeral joint mobilizations will help out with lateral epicondylitis.
Okay.
Some, maybe osteopathic doctor may use what's called a Mills manipulation, and it's a certain manipulation where you're going to take the wrist into full flexion.
Similar to the Mills test. The special
It
test.
is. It is, but you take it all the way into end range quickly,
Okay.
and you'll hear a snap with it. So basically, it's going to be like this, fast. And so the clinician stands behind the patient and then does that quickly.
Okay.
That's not something that we're doing here. There is a little bit of pain initially involved with that, but that's not very commonly used in a rehab setting.
Okay.
Would you use ice or phenophoresis for inflammation and target that before you did any kind of exercises, or could you still do exercises when they're in inflammation?
This is kind of up in the air. If you listen to some clinicians about treating the condition that we're talking about, some of them will want you stretching right away. Some clinicians will say, do not stretch. We're going to do rest, or we're just going to do very gentle strengthening at first. Ice, certainly if you're still in an itis condition, you would do. But maybe you want to consider doing exercises that are affecting posture and any faulty movements. So one thing we do is we do what's called the Selective Functional Movement Assessment, or for short it's SFMA.
Okay.
And that's a full body screen that will take them through, neck down to toes. And then you kind of tease out any problems that you're seeing. Because if you have a problem anywhere in the whole body, you end up accommodating in your movements and your postures, and you change things. And so you and I were talking on the phone that if you have a patient with lateral epicondylitis, be sure you check the shoulder.
Proximal and distal.
Yeah, you always want to check proximal and distal,
Yes,
but if they're, and the example I gave you was that if they're lacking external rotation, motion, or strength, they make up for it with wrist extension. Every time they reach out to the side, let's say you're driving and you want to get your wallet that's sitting in the seat beside you, and you don't have full external rotation to go get it, it's going to look like this. You're going to be doing this. And so throughout your whole day, you're always kicking in the wrist extensors. You overuse it that way. So you kind of want to look at everything that way.
Yes, sir. That's exactly what my next question was going to be, to talk about the compensatory talk that you discussed with me before.
Yeah.
Yeah. That's perfect. For the treatment of progression of lateral epicondylitis, could you kind of just shed light on that for us?
Again, it's going to depend on where they come in,
Right.
and where they start. And to be honest, in a rehab setting, come in and say, I thought I was going to lick this, and now it's 3 months, it's 6 months have gone by, I still have it. And that's
Right.
where we tend to see them.
Yes, sir.
So we are going to do the scraping, and we are going to do the needling. Of course, go through the whole SFMA with them and look at compensatory movements. But once we get the pain down a little bit, we'll work more with strengthening. Honestly, we don't do a ton of strengthening first. If it's already irritated by just picking up a pot or pouring a pitcher, you just have to be careful with how aggressive you are on your strengthening. On the lateral epicondyle, even at rest, because a muscle that has a trigger point in it is in a state of hypertonicity. And you're trying to get that thing to relax so that the muscle can also relax and elongate. Any muscle that has a trigger point in it is going to be a shortened, tight muscle.
Right.
Also weak. So you want to work on getting the trigger points out of the muscle belly so that even at rest, it's not tugging on the lateral epicondyle.
Okay.
So for the needling, we would do through here, but we would also hit right at the lateral epicondyle.
Awesome.
And that releases tension at the muscle belly.
Mm-hmm.
It releases the trigger point.
Yeah, it's called offloading, basically.
Okay. Cool.
Great.
Well, thank you so much, sir. We really
Yeah.
appreciate it.
Yeah, sure.
That's great. Thank you
Yeah.
so much.
Absolutely.